Hi, I'm Larry Mike Gurnder, and welcome to this edition of Profiles. And as we usually do, we have our doctors on TV to answer some of your medical questions and give you some medical knowledge you might want to know. And with us today, we are indeed privileged from Complete Orthopedics, Dr. Ambreen Sharif, who is a podiatrist, and she's going to answer some of your questions. First of all, we have to start out. There's men and women, they both have kind of different foot problems and stuff. What's some of the most of the problems that you see?
All right. Well, first of all, Larry, thank you so much for having me. My name is Ambreen Sharif, Dr. Ambreen Sharif, and I've joined Complete Orthopedics recently, and really glad to be here. So thank you for having me. I think we see a lot of different problems. You know, there's a variety of issues that men and women deal with when it comes to foot care. It's an issue that's very difficult to ignore, really. Once your feet start hurting, it's really not much long that you wait before you getting it treated. A lot of people are on their feet all day, you know, working, taking care of children, or just out and about. And not everybody's educated on proper shoe gear. So I think having improper shoe gears, wearing heels for years, wearing work boots for years, we see all kinds of issues. And then you add in other health conditions like diabetes and stuff. It brings in a myriad of problems that have to be treated. I think we specialize in everything ranging from cosmetic corrections such as hammer toes, bunions, all the way to, you know, diabetic population and doing major reconstructive surgery.
Now, what exactly are bunions? I mean, you
Yeah.
know, it sounds like onion, but
Right, right. I think there's a myth that wearing tight shoes causes bunions. It's basically when, you know, you've got your big toe and the big joint, ball of the foot underneath there, and sometimes just kind of starts going crooked, starts going the other way. Many, many different conditions. Very seldom does it have anything to do with the kind of shoe gear that you're using. A lot of it is genetic. And it's the way that your foot works. It's the way that the muscles and the bones in your body are structured. And sometimes there's really not much you can do to prevent that from happening. Sometimes, you know, you can do some exercises, maybe move your muscles around, ligaments to maybe prevent it. But if you're born with the things that are going to cause a bunion, you're going to end up with a bunion in the future, right? Now, many times people are able to get things like orthotics or conservative treatments to accommodate for it. Again, not completely treat it. It's like kind of putting a Band-Aid on it. And most people are able to go their life without having any issues. The issue starts happening when it starts getting painful, when it starts rubbing on the side of your shoes. You're not able to walk, run, perform any activities without it being painful. When it does get painful, what we have to do is basically make that crooked toe back straight again. It can require some bony correction, but it can also require just some soft tissue correction as well. So there's a variety of different procedures we do. Back in the day, these surgeries used to be much bigger, you know, longer incisions, but in this day and age, we often, especially at least in my practice, we specialize in minimally invasive surgery as well.
right.
So that means smaller incisions, faster healing time, you're walking sooner, you're not in that big giant cast or boot for a very long time. And depending on the kind of bunion that you have, the surgery can vary. So it's not like a one size fits all kind of procedure either. But there are a lot more options now available than we did have back in the day.
Right. And again, with hammer toe, another one I hear about is these things called spurs. How do you get spurs on your feet?
Yeah, you know, it's very interesting. Spurs basically can form on the bottom of your heel, on the back of your heel, anywhere sometimes where you have some irritation. Spurs, I think, is the common word that we use. There are many different kinds of things that happen. Wear and tear can cause, you know, just bony prominences to get more prominent, really, and then they can become spurs. A lot of the times, areas on the bone where your tendon attaches, which is tendon is what connects your muscle to your bone, over time, when it's working over time, it starts to cause a little spur. then that leads to things like tears in tendons, ruptures in tendons, and just really bad irritation as well. The most common areas that we see spurs in the foot and ankle is on the bottom of your heel, where it starts to rub into your plantar fascia, which causes a lot of that plantar fasciitis pain that we hear about a lot. That's a treatment that, that's an issue that we treat a lot. Again, treatment for that varies all the way from conservative things where we give you maybe like a steroid, some exercises, we can do steroid injections, all the way to a quick surgery in which we go in there, maybe shave down the spur a little bit, usually not, or maybe just exercise and release that tendon, release that ligament where it gives you more ability to move better and it's not as painful anymore.
And it also depends on the severity. I mean, if the person has like, I've seen some of these things on x-ray, they look like an arrow point.
Yeah, they look like an arrow point.
Really scary.
Contrary to popular belief, it's usually not the spur that's causing the issue, So sometimes when we go in there and shave it down, people come back and they're like, oh, that didn't solve our problem, right? So sometimes it's something else that's happening as well. Now, on the bottom of your foot, you have to realize the bottom of your foot takes and handles the entirety of the weight of your body. It's a lot of pressure. It doesn't, it's called a weight-bearing joint. It gets a lot of pressure. So the plantar fascia is a thick layer of tissue down there that's basically handling every time that your foot is on the floor and you put your entire body's weight on it. So that spur can dig into that plantar fascia and cause many tears in it. So that you can imagine, it's pretty painful. But thankfully we have a lot of ways of treating it, and sometimes it's just as easy as wearing shoes more often and the proper kind.
And believe it or not, diet actually affects the feet too, because you get this beautiful thing known as gout. And I've seen pictures on the internet that's like really scary. It's like Bigfoot and everything else like that.
Yeah, it can get a little scary.
With gout, how do you end up treating that? Now, they say there's these crystals that form in your body, and they're actually like spears. And then the other one is pseudo gout, where they're shaped oval. But either way, it's a lot of pain.
It definitely is a lot of pain. So the shape of the crystals that you're describing, actually, they're on a very microscopic level. So thankfully, you're not seeing sphere-shaped, crystals on your body. That does sound very painful. Gout is a condition that's caused by many different issues. A lot of it can be your diet. Sometimes it's about the medications that you're taking, the different balance of different electrolytes in your body. So an increase of urea in your body is what causes gout. Some people are on chronic medication for it to kind of keep it stable, but periodically people can have a gout flare-up, which is when your foot or wherever joint there is a collection of those crystals that starts to happen because there's too much urea in your body. So instead of your body getting rid of it and excreting it, it's collecting it in some joint.
So we'll just send it down to the feet. What the hell?
I know. They just send it. They're like all the way down, push it down over there, and then it starts to expand, it gets red, it gets hot, and it gets extremely painful. It's like, we describe it in a way that even a bed sheet that touches your foot, you'll be screaming in pain. So what we do is medication is definitely necessary to keep it at bay even after you have a gout flare-up. A lot of the times we actually have to go in there and drain that joint out, which means making a little incision and taking out all of the crystals.
It's like an aspiration or something?
Exactly. It's an aspiration, and then we treat it like a wound, and usually it's a very controllable situation, at least if you're aware of it, you're taking medication properly, but there's a lot of things in your diet that you have to be careful of. Not a lot of protein, dark meat, red wines, beans, things of that sort can cause gout. So if you know you have a tendency of gout or a condition, underlying condition, you should definitely lay off of those.
And that also can be a genetic thing, right? That it's passed down from generation
sometimes
to
it can be like that too. Yeah.
Now the other thing that, and I know that you guys treated there, is arthritis in the foot and the joints. When we talk about pain, that's got to be another thing.
Right, definitely very painful. And so we treat patients all the way from little kids to people that are, have been working for many, many long years. Lots of wear and tear in their joints. And being the foot and ankle specialist, like I said, ankle being a joint that takes the brunt of a lot of this. So sometimes arthritis is basically when a thing called cartilage, which covers the joint, the bones in joints. So like ankle, when the bones meet each other, they have this white coating, which is nice and shiny and smooth, so that when bones touch each other,
like a ball bearing.
Exactly, exactly. So they're just kind of gliding against each other. Now, over time, you glide long enough, it starts to wear down, right? When it wears down, now you just have bone-on-bone contact, and that is really, really painful. A lot of the times we're able to manage it and keep it at bay with steroid injections and, accommodative shoe gear and things of that sort. But there comes a point where you really can't handle it. And at that point, you have two options, really. You go towards an ankle replacement or a joint replacement. It doesn't even have to be ankle, believe it or not, Larry. We actually replace the big toe joint, too. We have a little joint replacement for the big toe. And so, back in the day, the only option when you have arthritis and it's that painful is that you fuse the joint, which is you take both the bones, put them next to each other, throw some screws on it, and that actually gets rid of the pain. But you're also kind of stiffer at that point. You're not able to move around more.
Because you don't have that movement of the ball bearing.
Exactly,
and everything. And
exactly.
also the lubricant, which I believe sometimes you guys use collagen, right, to keep the joint.
Yeah,
moving.
so before considering surgery, conservative treatment, there's a lot of different fluids and, collagen, PRP, things of that sort that can increase just like good cells in the joint to, continue to let you work as much as possible. But there comes a point where you really have no other option. So that's a fusion or something that we used to do. We do specialize in joint replacements as well. So first, big toe joint replacements, ankle replacements, things of that sort. So outside of that, I think one of the other bigger kind of tenets of foot care that we deal with, not really necessarily related to arthritis, but that's bigger corrections like having a flat foot or maybe a really high arched foot. A lot of people can get arthritis much earlier on in life because of just the way that their foot is structured. Now, if you've got a flatter foot and you've been walking on that flat foot for long enough, those bones are not sitting properly. They're grinding against each other, and you end up getting arthritis at the age of 35, 40 sometimes, and we've got to do something about it. So that's another thing that I specialize in. We do reconstructive surgery for flat feet being also another big cause of bunions. So those usually go hand in hand. A lot of the times the patients that we get come in complaining of a bunion, and we realize then it's a bigger issue than a bunion. It's actually a flat foot reconstruction. We also do high arched feet. Sometimes those can get really, really painful for people.
Yeah, that was going to be my next question. What are fallen arches? You hear about fallen arches?
Yeah, and again, some people are just born with the genetics that predispose them to getting falling arches a lot more sooner than other people. Bones are held together by ligaments and tendons. There's many different reasons why your muscles can stop working. Sometimes it can be a neurological issue. Sometimes it can be an accident. That just happens. So many different reasons for why it happens, but we also have a lot of treatments for it. But what's very important is wearing proper shoes, getting orthotics. So surgery is not the only solution for everything. So what we do is a full, complete care. You come in to see us, say you have an issue, right? Be it a bunion or flat feet. We'll start from the beginning. What kind of shoes are you wearing? Have you done anything to help it? Maybe some stretches, icing, exercise, right? If that hasn't worked, okay, orthotics. So orthotics are what we call inserts in the shoes. We make you special orthotics that are actually fit to your feet. So you don't have to go pick up those Dr. Scholl ones from Walmart that really don't do much. And these are custom orthotics. And those last you a very long time.
Well, you guys do like pumps and stuff like that?
And orthopedic shoes for the diabetic population, and I know we haven't touched the diabetic population yet, but that is something that we do. We make specialized shoes for them to their feet because they need those shoes.
That's fantastic.
So I think at that point you realize you've done the conservative treatment, it's not really working out, so then we look at different options for surgical corrections.
Now, let's go up a little higher into the ankle.
Okay.
You get, I believe it's called like an edema, the swelling of the ankles. and a lot of women I know suffer from this.
Mm-hmm.
What's basically the cause of that? What's what's the remedy?
I think edema is swelling, like you said.
Right.
You know, there's many different ways and reasons one can get edema or swelling, be it man or woman. Sometimes you're just standing for a very long time and you get swollen because your body just can't take the weight. A lot of people end up getting edema, and that's the first sign of a bigger thing that's happening in your body. People get really swollen feet and ankles and legs when they have an underlying heart condition like congestive heart failure. You can get something called lymphedema, in which the pumps that are supposed to get the fluid back from your feet all the way to your heart, they're just not working as well. So the veins, valves have collapsed. The pumps are just not working. Then all the water gets retained in your feet, because you have to understand the heart's a pump, right? The furthest thing away from them
It's the feet.
are the feet.
Right.
So they are working the hardest. When they're working over time, it's really difficult for them to get the blood all the way back up, and sometimes that starts failing. And when it's pooling, you end up getting swelling in the feet.
Right, and like you said, there's these little valves that are in the veins that are supposed to open and shut, and sometimes they're not. They're half shut,
Exactly.
half open, not
right,
closing,
or they collapse.
Yeah.
Many different things that can happen.
And there's surgical treatment, I believe, for that,
yes. Many, definitely there's surgical treatment for it. And at Complete Orthopedics, I'm sure that they have people who are performing that. And outside of those, you can conservatively sometimes manage it because for compression, it's very important to do something that keeps the blood moving. So we have pumps that you can wear. It's like a sleeve. You turn it on once a day or something, and then it keeps pumping the leg. So it's kind of like giving an external pump to your body to get
almost
that.
like a massager. That's
Exactly.
moving
It just feels like a massager, but it really is just pumping the blood back to the heart. Compression stockings are very important in that case. Those definitely decrease the amount of swelling that you get as well.
Well, that's a good thing about Complete Orthopedics. It's like one call does it all.
Right, exactly,
And
from the head to the toe.
So basically, if a patient comes in and I'm having ankle swelling, feet problems, the first person they're going to go to you, and you're going to put them on that little foot thing, and all these digital. You have a lot of stuff in your toolbox to take care of them.
Yeah.
Then if you find that there's an underlying problem, that you go to one of your other doctors, such as Dr. Kakari or some of the other spine specialists that work there, and say, hey, look, this person has this, work with me to help them get this thing, that's really fantastic. So you're not going from 5 different doctors.
Exactly.
Everything's all in one office.
Well, 100%. And I think the other thing is we have patients that are coming from far away, close by. We have offices all over the island, going into Queens, even into the city. So if, let's say, you prefer seeing one of the other specialists at a different location, we can always accommodate for that. And the thing is, we forget often that the whole body's connected. You have, just because it's a foot issue doesn't mean that, it's not a heart issue. And I think all of us have to be physicians of the whole body, right? So, this kind of leads me a little bit into talking about diabetes, because more than, I would say, at least 50% of the population that I see are diabetics. I did a lot of my residency and fellowship training in treating the diabetic population, and there's a large population of the USA that's slowly creeping towards getting diabetes. A lot of them are controlled and managed, but unfortunately, when a diabetes is not controlled properly, it can lead to feet issues, something that's called diabetic neuropathy, where the nerves in your in the feet stop working. Again, going back to the heart being a pump and the foot being the furthest away, it just kind of, if you really want to think about it, there's enough sugar in your body that kind of crystallizes, and the really, really small blood vessels that are in your feet don't allow blood to go as much. You start getting foot infections, diabetic foot ulcers, because you're not able to feel your feet. You get neuropathy, that means no sensation in your feet. Sometimes you get wounds and you don't even know about it. So it's very, very, very important to have monthly, or we recommend at least 3 times a year if you are a diabetic, to come in to your podiatrist and get your feet checked. It's a very simple thing. We do a complete foot check. We check the nerve sensation, the blood flow in your feet, your reflexes, and just make sure everything's doing okay.
Right. And if you spot something, you spot early, it's easier, much easier to take care of.
100%. It's much, much easier. In addition to that, we can also see the structure of your foot, right? So let's say you have a higher arched foot. You're more prone to getting these ulcerations at the ball of your foot, on the outside of your foot, on the bottom.
Right.
So we can recognize that and maybe create you an orthotic or something that can prevent any further pressure ulcers or things of that forming that can then get really bad and then get infected. And the worst possible scenario, you get a bone infection, which most often than not has to be treated by an amputation.
Right.
So we do everything to try to avoid that. Now, let's say you do lead down that you need to have a diabetic workup and get any ulcer treated or a bone infection treated. We definitely take care of that. Another condition that is not common but prevalent in the diabetic community is a thing called Charcot neuroarthropathy, in which unfortunately your bones start to deteriorate when your sugar levels exceed a certain level. Your A1Cs are way out there above 10, and it is a really sad condition, but in those cases we've got to do something or people are going to lose limbs. Right? A lot of people get below the knee amputations for that. But there are some times when if you catch it early on or if you catch it right at the right time, you're able to reconstruct the feet and the lower extremity and give it the strength that it needs using hardware so that it doesn't deteriorate even more. And that's something that I specialize in for my fellowship. I do reconstructive Charcot surgery, in which we do intramedullary rods that are rods that go from your foot all the way to your knee. You've heard of rods in your thighs and stuff. It's a similar concept. In addition to that, we do fusions of the whole foot. So this condition can happen just in the foot, just in the ankle, or both. So according to what condition you have, it's really, really helpful to make sure that your diabetes is controlled. You're getting it checked early on. We do regular x-rays, making sure that nothing's happening to your bone. Unfortunately, there's not a lot of education about this. People don't find out about this until they come to the doctor. They say something's going on, and we take a look at their x-rays, and the bones are deteriorated, right? It's sad sometimes. There's not really any reason, rhyme, or rhythm to why Charcot happens. There's a lot of research happening about that. So sometimes you can't prevent it, but we're just thankful we have ways of treating it now.
But the one thing we do know is that obesity does not help. And most of the diabetics type 1 are obese, and they have a weight problem, and that weight just adds more to the issue.
Right. Type 1 diabetics are different than type 2 diabetics in the sense that type 1 diabetes is more genetic. It's a condition in which your body doesn't produce the right chemicals. Type 2 diabetes is when your body doesn't respond and produce enough insulin.
Resistance.
Right, insulin resistance. And so I think obesity is something that's on the rise around the United States. I think all of your health factors contribute to obesity contributes to all of different other health conditions as well. And in just simple math, when you're trying to hold something up and the foot is the only thing you've got, if it's not a proportional weight to your body, it's taking a lot more stress and pressure. So having a controlled diet is very important as well. Keeping your sugars low, being active is also very important. So sometimes it's a tough discussion to have with patients because they end up getting pressure wounds, let's say on the bottom of their feet. But we do need them to be moving around in order to continue losing weight. So it's important to have, a kind of interdisciplinary approach where we're speaking with your primary doctor. So I like to make sure that if I have a patient that has a condition like this, I speak with their primary team, their family doctor, their endocrinologist who's maybe prescribing the medication for the diabetes. You speak to vascular surgeons that we have in our network that we speak with, saying, hey, let's check the blood flow, how's that going? And then, we have a lot of these other specialists at Complete Orthopedics, so I think we all go for a very multidisciplinary approach of treating the patient.
Right, because, like you were saying before, but the thing is that all diabetics are urged to exercise.
Right.
And if your feet are not working properly. It's very hard to lose weight sitting
Yeah.
on the couch watching TV.
Exactly.
So, you know, that's where the whole team comes into effect and
Exactly.
stuff like that.
Very important.
And then, you know, the an ounce of prevention, it goes back to that, you know, stop it before it starts. Come
Exactly.
down, see the doctor, get the test. You know,
100%.
it's not like they're going to be in there from 9 to 5 when
No,
they see you.
it's
It's
quick.
a very usually
Yeah.
a quick thing.
It's a
You know.
quick thing. You're in and out. We have everything on site, X-rays. We have all the equipment that you need, and we can do it all. So, but I think it's very important to go see as a diabetic patient. I would definitely recommend seeing your podiatrist at least 3 times a year.
Right.
That would be very important. I think in addition to that, other kind of procedures that we do treat that specifically in the diabetic population can be dangerous, but also are very painful in the normal population are like ingrown toenails or any conditions that come with nails, right?
Right.
A lot of the times we go to the pedicurist, or especially if you're a diabetic patient, you should not be going to get pedicures anywhere.
Right.
Especially if you don't know what the sanitary conditions are of
Right,
this
because
pedicure place.
They're more prone to infections,
Yes.
especially in the feet.
Yes. So
Right.
if you're a diabetic patient, you should not be cutting your own nails. You should not be going to a pedicurist. You should be coming to a trained podiatrist to get your nails cut, any calluses debrided, or any care for ingrown toenails, because even the slightest nick in your foot can cause a much bigger issue than needed.
Right. And you guys are trained professionals. You know how to cut the nails and everything like that.
Exactly. And we have good sanitary equipment and we're trained to use as
Right.
well.
Do you guys also do the painting and the little stickers on
No, we don't do that. You've got to go down the street for that one, but
Because I know, especially with the women, they're very concerned how their feet look. They're going to wear flip-flops, stuff like
Yeah,
that,
yeah,
you know.
yeah.
And, you know, that's another thing. It's the type of shoe wear that you're wearing, you know, around what time. I mean, you know, flip-flops are very comfortable. People like them
Yeah.
in the summertime. But you're really, like, exposing all your toes and the majority of your foot to the
Right.
outdoor
yeah,
elements.
yeah. I think more than, just exposing your toes, it's that flip-flops are so flimsy.
Right.
Flip-flops really don't have a lot of structure, especially when you're walking on the beach on the sand. That's not a flat surface for you to be walking on. You don't know what you're going to walk on, especially if you're a diabetic patient. Let's say you don't have a lot of sensation on the bottom of your feet. We've had a lot of patients that come in with actual nails sticking into their foot, and until they touched
Oh,
the
my
bottom of their
Lord.
foot, they didn't even know that it was there.
And then it
There's
gets
a
red, infected, and swollen.
And by the only time that they find out about it is when they go home, or maybe they're taking a shower, or they look at the bottom of their foot and they realize, oh, what's that hanging out there?
Right.
So especially on the beach, and anytime you're barefoot or any other place, you got to be very cognizant of where you're walking and what's on the feet. I think shoe gear is really important. You need something that's supportive. A lot of shoes these days don't give, they're very flimsy, I would say. It's very important to have something that's very strong and brings the foot to your ground rather than bringing the foot down to the ground, if that makes any sense.
Yeah, we're basically out of time now, but I do want to thank you for coming on and explaining some of these things. So if people out there who realize they're having a foot problem, don't wait. Come and see the
100%.
doctor, you know, and this way they know. Stop it before it starts is always the best way, instead of putting it off like, oh, it'll go away in a day or two, and 2 months later go by and your foot's like the size of a watermelon or something. But thank you so much for coming on,
Thank you so much.
Dr.
Thank you
Sharif.
for having me, Doctor.
And maybe you'll come back in the future and fill us in about some of the new techniques that they're using.
For sure. I'll be happy to be here.
Okay, thank you so much.
Thank you.
Until next time, I'm Larry Microrender for Profiles. Have a great day. We'll see you soon.